Alright friends, in this video I'm going to show you why soy phytoestrogens do not increase the risk of breast cancer in women or feminization or low testosterone in men. And I'm going to describe the concept of full versus partial agonists. And at the end of this video, I can guarantee you will never worry again about eating soybeans or soy products. So the problem is that soybeans and soy products have phytoestrogens, things like diazine, genistein, and other compounds, which chemically speaking look fairly similar to the estrogen molecule and thus are able to bind on the estrogen receptors we all have in our bodies. And by activating these receptors, many people are concerned that soy products will cause negative side effects such as those that I just mentioned, especially since we already produce estrogen hormones in our own bodies, and that is true not just for women, but men also produce estrogen, though in much lower quantities. When we have a substance, a drug, a hormone, or a phytoestrogen for that matter, absorbed in our system and it acts on the specific receptors for that substance, for that hormone, it activates them. Now, the activation is not the same. Estrogen is considered a full agonist, meaning when it binds on those receptors, as you see in this graph, the effect goes up and then it reaches a plateau beyond which it stays flat, more or less, no matter how much we increase the dose of estrogen. And that is important to understand. It's also a defense mechanism. Many people imagine that the more you give a drug or a hormone or whatever, the higher and higher the effect will go until there is no end to it. When in fact, you have this S-curve that is very typical for the vast majority of drugs and hormones and how they act in our body. So again, the estrogen is a full agonist. You go from 0 to 100% efficacy within a domain of concentration. And when you reach the 100% of response, if you drop down a line in the bloodstream, you have the concentration that gives you the maximum effect, so to speak. A partial agonist, which would be the case of the soy phytoestrogens, is a substance that again activates the same receptors, elicits, produces the same effect in the body, but at a much lower magnitude. And you see the same S-curve. It goes up, but it reaches an effect, a maximum effect that is significantly lower than the effect of the estrogen, of the full agonist. So what's the first conclusion we can draw from this? The first conclusion is that phytoestrogens, while they activate the same receptors, the resulting effect is much smaller. And this is important. This is why they are not so dangerous. And no matter how much you increase the amount that you eat, the effect plateaus and never reaches the same level of magnitude as the response you get from the full-blown agonist, from the estrogen. But you may be wondering, what happens when we have both estrogen in our system and we eat these phytoestrogens on top of that? Wouldn't that blow through the roof of the effect and increase our risk? Well, here's the kicker on this thing, and this is the most important part of what I'm presenting here today. When you have both products in the system, yes, the effect starts higher up. In fact, it starts at the top of the partial agonist. And it goes up and reaches eventually the maximum effect the estrogen alone would reach, but it never goes higher than that because, again, you saturate all the receptors, you get all the effect that you can get, and there's nothing more to produce beyond that, no matter how much estrogen or phytoestrogens or a combination of these two things you have in the system. So the maximum effect is the same. However, and very importantly, because you start with these partial agonists blocking or occupying some of the receptors for estrogen, what that does is it delays the moment you reach that maximum effect, and you will need a higher concentration of estrogen to dislocate these phytoestrogens from the receptors for the estrogen to eventually saturate all the receptors and produce its maximum effect, that 100% effect. And if you drop a line down from that level, you will see that the blood concentration of estrogen that you need for that effect to be reached is significantly higher than the concentration that you will get the same effect with estrogen alone. So the second conclusion that this graph illustrates, I hope very clearly for you, is that in the presence of soy products, these partial agonists delay the maximum effect of the estrogen that you can get from your own estrogen, or if you take estrogen as a supplement. And in this sense, they actually act as anti-estrogen to some degree. They have an anti-estrogen effect. So in conclusion, the effect you get from the phytoestrogen is significantly lower than that from the estrogen itself. And secondly, when both products are present in the system, you will see an anti-estrogen effect that these phytoestrogens have. And this is why in study after study, we see actually a protective effect in people who consume soy products in terms of their risk of breast cancer and other estrogen-associated risks compared to people who have a low intake or no intake of phytoestrogens. And I'm grateful for my son to have put together this animation graphic for you. I hope this was helpful for you. Until next time, you stay healthy and you stay wise, my friend.